together with all representatives from all hospitals, public and private. As we all get to our seated, I'd like to have you all upstanding for the national anthem. I believe that we're all Tanzanians, and so there's no need to play the tune. We shall all be singing the national anthem. Thank you very much for your attention, and I will lead you in 1, 2, 3. Mungu ibariki Afrika, wabariki viongozi wake, hekima, umoja na amani. Hizi ni ngao zetu Afrika na watu wake. Ibariki Afrika, ibariki Afrika, tubariki watoto wa Afrika. Mungu ibariki Tanzania, dumisha uhuru na umoja wake kwa waume na watoto. Mungu ibariki Tanzania na watu wake. Ibariki Tanzania, ibariki Tanzania, tubariki watoto wa Tanzania. Thank you very much. You can all put your hands together for yourselves. Wonderful. Have you seated, please? It is a custom for our communities to begin with a prayer, and what we just did is we have already called God's gracing to all that will be happening from today onwards, 3rd of April till the 5th, as we'll be gathering here for the Symposium on Emergency Medicine and Critical Care. Without further ado, I'd like to welcome Chairman of EMSA, Dr. Sylvester Fire, for opening remarks.
Good morning. Ladies and gentlemen, welcome. On behalf of EMSA, Emergency Medicine Services Academy, I invite all of you to join us in our introducing our new course in the field of emergency medicine. Excuse me. This is a basic course. Basic being basic assessment and support in intensive care. An intensive short duration hands-on training consisting of lectures, skill stations, and tutorials taught by intensive care specialists. The emphasis is on practical approach to management of critically ill patients. My fellow colleague will come here and elaborate further about this particular course. Let me say it follows EMSA's tradition of bringing internationally recognized courses to our country. Many of you, as you are aware, EMSA is a leading medical education enterprise in Tanzania, specializing in training in the emergency and critical care. EMSA has established itself as a premier provider of continuous professional development, CPD courses, under the banner of the American Heart Association. EMSA is also an accredited American Heart Association training center, but also recognized by the Medical Council of Tanganyika and Tanzanian Nurses and Midwifery Council as a CPD provider. Additionally, EMSA is a chapter for the International Trauma Life Support, ITLS, and now BASIC. All our courses are run by professionals and peers in the field, often involving medical and industrial partners, active in the care of acute and critically ill patients. Hence today, among us, we have many senior and junior colleagues from various areas in the field of emergency medicine. We also have CEOs of health and non-health institutions, heads of departments, and a number of salespeople as well. In particular, I wish to recognize the presence of Dr. Mpoki, a well-known personality who served in various capacities in this country. He has kindly accepted to be our guest of honor this evening. I also wish to recognize the presence of MAT, EMAT, and AFAT presidents. Of the senior colleagues, I would like to thank Dr. Yahya Ibuge for agreeing to join us this morning, and Dr. Osati, who is a well-known figure to us as well, is here with us. So with these few remarks, may I again say, welcome to the symposium. Thank you.
Thank you very much, Dr. Fire. Let's again put our hands together for this wonderful orthopedic. Ladies and gentlemen, just if you're very keen enough, I picked something from Dr. Fire's opening remarks, and he said he's glad that he's here this evening. Did we all hear that? We all missed that. I understand the fact that we're all in emergency departments and intensive care units, lights never go out. So really you don't know, it has turned dark or is it daytime? Thank you very much, Doctor, and we appreciate your presence here. Fellow colleagues, as Dr. Fire remarks, we are graced with a number of colleagues from different hospitals, both public and private. I would like just to recognize the presence of head of departments from emergency medicine from different hospitals. If you're around, please just wave by wave of hands. Head of departments from emergency medicine departments, intensive care, yes, thank you very much. Thank you very much. Intensive care units, thank you very much. Medical officer in charge from hospitals, partner hospitals. Medical officer in charge, thank you very much. Thank you. Representatives from all participating hospitals and partner hospitals, if you're here. I thought we were all representatives. Up next is the heart of EMSA, the vision bearer, the person that has managed to take us over 10 years and still keeps gathering us for different occasions. This morning, I'd like to welcome Dr. Ramadhani Chunga for his presentation on SEMC. Please, let's put our hands together for Dr. Ramadhani.
Thank you. Thank you for a wonderful inauguration talk. Thank you, Dr. Fire, for a wonderful description about EMSA and the welcoming note of everyone that has been in the floor. I just want to echo again that thank you all for joining this occasion, and you're welcome to this event. I'm tasked this morning to elaborate about SEMKI as part of what we are doing, and we will be doing many years to come. Before I continue, I just want to again echo and thank the guest of honor, His Excellency, former High Commissioner for Tanzania in Canada, who also happened to be our colleague and our past Principal Secretary, Permanent Secretary of the Ministry of Health. So please, let's thank him with claps. I also want to thank the team that is putting a lot of effort in our critical care development in Tanzania. And this is the team alongside with Dr. Raul from Cuba. And I would like to ask and to request that you stand up and wave to this critical care team of the future. Please stand up and say hi to the critical care of the team. After that, I would like to thank my friend, my colleague, Dr. Baraka, who is the head of intensive care unit in Muhimbili, Upanga, who has actually made a great effort to have this happen. So thank you again and welcome. I would like to recognize and appreciate the presence of the representative of the President of Physician Association of Tanzania, who happened today to be Dr. Elisha Osati. So please say, we all know him of his excellence in the field of pulmonary physiology, and he has happened to be our teacher as well. Also, I would like to recognize the presence of my mentor and colleague, Dr. Yahya Puge, who is here, came here with us to see the young generation. I would like also to recognize the presence of our partners who have made it possible for us today to be here and learn important skills. And I will start with recognizing Mr. Arun from EMERGRNCE, who have been very fundamental in producing the technology on management of acute coronary syndromes with Tenecta Place and the Ato Place in Tanzania. They are the partners that have been helping us. We do also have the presence of Mindre from headquarters. They are also visiting us. You can see our machines that we are using for training are actually coming from Mindre, and they've been here. So please wave and say hi. Also, one thing that is not usually common, but I would also want to recognize, hosting our event in this great building was not possible without the help of one person with her team, and this is Nikki. Please say hi. This is a manager of this hotel. Thank you so much. But as you understand, this event is not going to be possible without a great number of specialists and physicians who have devoted their time of seeing patients today, and they are here impacting the knowledge and transferring the knowledge to you. I would like to recognize all specialists that are in this room. If you can stand and say hi, please. All specialists, emergency physicians, critical care specialists, thank you so much for joining us here. Now I will take a moment to speak about SEMKI. SEMKI is a platform that talks about emergency medicine and critical care. We want to have this platform in order to have our voice along the profession and have our platform where we can learn a lot of important skills. SEMKI addresses the priority of the government in the area of emergency and critical care. SEMKI addresses the priority of the government in capacity building, and the SEMKI addresses another need of access of care. I'm going to elaborate. So we do have common issues that we are all working. There are multiple partners and multiple efforts that are ongoing, and the government is working. The government has invested in a huge number of emergency departments along all district hospitals. We do have ICUs in all regional hospitals. We do have emergency medical departments in our tertiary hospitals. They have done this probably, I could say, over the past 2 or 3 years. And this is a great thing that we should all reckon as experts. We also see there is an inadequacy of our team as emergency and critical care physicians or practitioners. We do have an inadequate number. And I wouldn't want to mention the number. The number will be mentioned later. We do have also gaps in the medical care, and we do have gaps on physician. We understand the government is helping us with the infrastructure and specialty training, but as you understand, the basic knowledge of care is on non-specialist teams in the hospital. And that being the case, it is our duty to address that, to help the government into addressing the quality of care that we provide every day. There are so many focus that we're looking at, but one of the main focus is that the accredited courses that are available in the country at the moment are all imported. And at one time, we used to import with the specialists to come and train us. You all understand that doing that is expensive. EMSA has coordinated, and we have seen many efforts to bring all accredited, most of the accredited courses in Tanzania. We did have the American Heart Association courses, which actually we used to go to South Africa, to Kenya to have these courses. Now they are available in Tanzania. We now, just this January, we inaugurated a new course called Basic Assessment and Support in Intensive Care. We do believe in our emergency department, our SU, this course will be a great contribution to our effort in improving care. But again, the cost of all these courses being taken down by just having SEMKI, because we are looking into having partners support your training. I can tell you, and most of you may believe that most of us, we are here, we are not asked to pay. But we requested your hospitals to bring in staff, and they've given you time to come and participate. But it was without the effort of the partners, that wouldn't be possible. Lastly, the knowledge and the technology of emergency and critical care is very far, because we import the knowledge from America, we import the knowledge from Europe. But this knowledge, in order for us to make use of it, we need to make sure that ourselves are upgraded to the level where we can use ventilators, where we can use defibrillators. Meaning that SEMKI has a vision of bridging industry partners and healthcare providers in providing care. And this is why we are capacity building. Lastly, most of our premier conferences in the country are happening in metropolitan cities, whether in Dar es Salaam, Dodoma, or Zanzibar. SEMKI is zonalized. SEMKI goes to the zone, and we are going to talk about that. SEMKI, we go to Dar es Salaam. Inaugural course was in January, and this is the first SEMKI program. We'll go to Dodoma, we'll go to Arusha, we go to Mwanza, Zanzibar, and Mbeya. These are zones that 3 or 4 regions are closer, and we'll be working to that. By doing SEMKI, few causes are being addressed. We are addressing trauma care. We are addressing basic life support. The basic assessment and support in intensive care is the main cause for the event. So many other causes, accredited causes, are being provided during SEMKI. As you understand, guest of honor, in this symposium, we are going to have 7 parallel courses that are being run, and all the participants are going to be accredited. Basic life support, advanced life support, pediatric life support, international trauma life support, ABG interpretation, ECG interpretation, emergency ECG interpretation, and AOA in the management. All these courses are going to be given in the course of 3 days, and for these participants. And as I mentioned, is a technical forum, CPD accredited, led by professionals, hands-on competence, and informative sessions like that one that we're going to have tomorrow. We have mentioned decentralized, water bucket have cost-effective than usual, skill-based, local instructors. Each zone that we go, we are going to train local instructors, and we are going to work closely with the local partners, ICUs and the emergency department. In Dar es Salaam, we have partners with all ICUs here. That's why you can see ICU team from Muhimbili is here. We've got JKCI, we've got many other places. We've got SAFI, ICU is here, and these ventilators are coming from SAFI, and I would like also to recognize that their contribution, and that is something that you can appreciate, that we are all going to benefit from their contribution. As we see, industry partners are directly being involved in the symposium so that we share the knowledge. Other than that, the program, as I say, there are people who are here who contributed something, who came, and there are people who came here directly without any addition of money, and this is because of the industry partner. And our industry partners have got a lot of options. There is a fund, a delegate program, that whatever fund they provide, they help us to provide courses to a particular government working staff, and for that it means we provide it for free. They do have any other package that we can assist, and that one we have already been discussed with them. Other than that, I would like to thank you everyone, and I would like to welcome you to the SEMKI Dar es Salaam. Thank you so much.
Let's put our hands again together for Dr. Ramadhani Chungai. Thank you very much, Dr. Rama. The only things that I personally am interested, and why I'm interested with SEMK, is it's free. Aren't we all interested for that? Imagine that every year, as a medical personnel, similar to any other profession, you need the CPD points. And most of us have been hearing discussions over the break and in the classrooms, inquiring, am I doing the right cause? Because MCT needs 25 plus CPD. Are you in the right room? Mind you, we have heard that SEMK has a number of causes, and over the year, we run through all these causes. You might accumulate CPD points for consecutive 3 years, if so. But MCT wants you to get trained every year. Saying so means you are already part and parcel of SEMK from now onwards until further notice. Thank you very much, ladies and gentlemen. I would like to take this honor and welcome our representative from Mindray for remarks as our partner and our big-time friend. Let's put our hands together for Mindray. Oh, yeah.
Nice to see you all there. We are glad we were invited and see you all. And also we thanks for your trust. You see, here we have the EMERGRNCE ventilator, defibrillator. So we are proud of this, and very thank you for your trust, for your all trust. I think maybe some of you have heard EMERGRNCE before, right? And maybe you have used the EMERGRNCE machine before. So later, I would like to bring you something new, which new launched from EMERGRNCE, because you know that EMERGRNCE, as one of the global leading provider of the medical equipments, we let me share by this PowerPoint. By if ranked by sales from the resource 2022, we ranked number 27 all over the world by sales. And now our business covered all over the world. So we have many very positive feedbacks from worldwide, from Europe, from American, and all over the world. And even in China, we are the #1 company. We entered over 99% of the Tier 1 hospitals. Here you can see, for EMERGRNCE side, our solution almost cover all the procedure of one patient in a hospital, from the pre-hospital to maybe emergency department, and to the general ward, to the ICU, the theaters, as well as we also have the ultrasound product line and IVD product lines. And we have some more new product lines. So this here it is. We have three main product lines. Of course, the patient monitoring and life support is our main product line. So, sorry, I forgot to introduce myself. I'm EMSA. I'm the marketing responsible for the patient monitoring and life support product line, mostly focused on the Eastern Africa region and the Western Africa region. My colleague Tate, which is the salespeople responsible for Tanzania. So now we are here, and to give more support to our end users. And as for the ranked, you see, EMERGRNCE now, we are for the patient monitor, we rank world globally #2, just behind Philips. As for the ventilator, also we ranked #3, as well as anesthesia machine. So EMERGRNCE, actually, we are a top 1, Tier 1 level brand for the patient monitoring and life support. And next, I would like to take several minutes to briefly introduce what's new from EMERGRNCE, and also which is the latest technology globally. Firstly, it is our new transport ventilator. Before you may know, we have the ventilator which is SV300 here. We recommended to use it for the intra-hospital transport. But now we have the new one, specialized ventilator for transport. Why is especially for the, we said it's specialized for the emergency. So let's see. Now we faced many clinical challenges. Here is 3 main challenges, including there have too many and too heavy devices during the transport. We may need not only the defibrillator, but also the patient monitor, infusion pumps, right? And secondly, the handover procedure. What we want is to make this procedure quick, right? To rescue, to save the life. So how to make the procedure more simple and quick? Thirdly, during this process, during the transport process, we may face the oxygen suddenly off, or the oxygen pressure from the cylinder, the pressure is not enough. So how to reduce such kind of oxygen anxiety will be a problem. So according to such clinical requirements, we launched our new transport ventilator, TV50 and TV80. Here in this in this page, it shows the TV80, maybe not very clear, but it's okay. Compare with the normal ventilator, we recommended TV80 is because, firstly, it can combine not only the ventilator itself, but also we combined the patient monitor. Maybe you can see from there, we can just insert our transport patient monitor N1 into the ventilator. They can work together at the back. Just here, it is a very small transport patient monitor insert into the ventilator. And then everything from the bedside, or you can just input the patient's information from this patient monitor into the ventilator. So this is the first one. We can say it built-in patient monitor. And secondly, the infusion pumps. So you see, we have specialized trolley and arm for the infusion pump. So we see it can work not only the ventilator, it can combine the patient monitor as well as infusion pumps. And all of them support the Wi-Fi function. So the data from maybe ambulance to the hospital centralized center IT sensor, it can be the real-time data transmission. So you can call help anytime by the Wi-Fi or by 4G or 5G SIM card, like this way. This is first point, combined the machines, so to reduce the space and reduce the extra cost. Then all of our transport ventilator, we use the turbine inside. With turbine inside, it is air compressor means inside. So no need, if during the transport procedure, if maybe there's no enough cylinder for the maybe air gas or the oxygen gas, it can still use the turbine, internal turbine, to give the air gas pressure support. But here, why I mention this is because some of the other brands, they still use the pneumatic driven. So the oxygen cylinder and the very work-wild oxygen cylinder is necessary. But for us, still we can use the turbine inside to give the air gas pressure support. And then, easy to use. Here, this image, it shows the TV50, which is a small one. You see, it is the very small size and 4.5 kg, very lightweight, handheld. And then it also with the 7-inch touch screen. And even 10 hours runtime. 10 hours will be very, very enough for one-time transport. And then as for the oxygen accuracy, here we use the non-consuming oxygen sensor inside. Non-consuming means no need to maintenance, and no need to calibrate. So during the transport, you no need to worry about the oxygen sensor. And we have an oxygen consumption indicator inside to help to indicate if something abnormal. Besides this, we also provide the highest standard to face the harsh environments. You see, now we have the world. We can see the top level standard for the harsh environments. The largest temperature range, even the 50 degree, and the dust and water protection IP34. Even it can be used on the helicopter. We have such a certificate. For some other brands, they may very cheap and have no such input to do such a certificate. Okay, So this is just a very small and basic introduction. Besides these basic functions, we also can provide the ICU level ventilation, such like the synchronization technologies, the unique AMA, which is easy mode, like this. So here is just due to the time limit, just a very small introduce to you. Next, to make something interesting, let me use a video. Let me use a video to introduce our new defibrillator. This one defibrillator is now we have the new version. Let's see by the video.
Super durability ensures worry-free operation and fits in low-temperature environment with ease. Smart interactive design creates impressive operation and control. The larger HD screen supports better display. Flat UI and full touchscreen. Environment with ease. Smart interactive design creates impressive operation and control. The larger HD screen supports better display. Flat UI and full touchscreen allow for quick and neat control. Great adaptability ensures functionality under harsh conditions. Keeping the hard buttons for key actions makes rescue more confident. This versatile device can provide you more under unpredictable emergency scenarios. Integrating N1 as a monitoring module or taking it out as a standalone monitor, all at ease to satisfy your needs. Wireless communication ensures seamless data transmission between modules. Separate systems guarantee independent and uninterrupted operation of defibrillation and monitoring. Its professional 12-lead ECG solution offers an accurate diagnosis for the MI patient and transfers the real-time report to the target hospital. The integrated ultrasound functions give another boost for on-site diagnosis, providing intelligent operation guide to make the practice all-powerful. Redefining a mind-raised rescue triangle, the new solution reforms the entire resuscitation process. The first ever INT-X dual-factor review system guarantees a high-quality CPR performance. Real-time CPR filter achieves less interruption. Detailed records and analysis tools refine a systematic debriefing process. Innovative training system brings impressive training experience. With this closed-loop rescue approach combining resuscitation, debriefing, and training, the new vein heart solution supports continuous improvement of the rescue quality. Integrated patient database, centralized management of defibs in the whole hospital. The comprehensive pre- and in-hospital IT solutions bring about an advanced treat and cure system. In continuous technological advances, we expand the greater potential of rescue, keep pushing the boundaries of innovation, and step forward to the promise of a better and brighter life.
Here is just a brief introduce for our new defibrillator. I'm not sure whether you find something new. Firstly, we have the bigger screen. It is just basic. Secondly, we can, it's the same as our new transport ventilator. Our patient monitor N1 can be built inside into the defibrillator, the bigger one. We have two sizes, a small one and a bigger one. It can be built inside and make the data communication seamlessly. And thirdly, it is here for the bigger one, D60, we built inside the ultrasound function. Have you heard this before? This is EMERGRNCE unique. Here it is, you see, From the screen, you can see here we built inside the ultrasound. So during the transport process, if there have a patient with maybe the injuries, you can real-time check whether they have a blood inside and maybe some inside injuries like this. So that will be very useful for you. And here is the third point. It is we built inside the new training system platform. So if needed, you can contact with us later. And besides these new functions, basically for a defibrillator, of course, it should have the world's fastest rescue defibrillation time. So for Mandarin, not only the new defibrillator, but also the old version, we have the world's fastest defibrillation time. From power on to defibrillation, only need 5 seconds. 5 seconds from power on to defibrillation. And secondly, not only the basic standard 200 joule energy, we can also provide the 360 joule energy, which is also more and more popular in the world, mostly useful for the high impedance patients. Okay, so this is 2 more basic requirements for a good defibrillator, right? Okay, so that's all for our something new. I hope I can bring you something new to you and to let you maybe interested in some latest technologies like that. Thank you.
Very much. Thank you very much. Let's put our hands again for Mendray, our esteemed partners. Ladies and gentlemen, I believe the presentation that just ended is of much interest to us as emergency medicine practitioners together with intensivists. Up next is a commercial break, and I would like to welcome our host, my good friend Nikki. Please welcome for just a small word. I'm sure now we can call you Dr. Nikki. We have been spending months at this hotel as if it's our living room, planning for SEMC, and we appreciate. Please, let's put our hands together for Nikki.
Putting me on the spot, buddy. Good morning, and welcome to the CBD Hotel. We are really, really glad to have all of you out here today, and we really appreciate EMSA for coming through, and we are delighted to be their partners in this event, and we would like to welcome them in the future, and hope you keep doing events like this, and it's really beneficial for everyone in Tanzania to get this training, to get this exploration. So thank you for doing something amazing. So feel at home, like my MC has said, and enjoy the food, enjoy everything, enjoy your events today, and welcome to CBD Hotel.
Thank you very much, Dr. Nikki. Yeah. Ladies and gentlemen, our fellow colleagues, I would like this juncture to welcome one of our esteemed colleagues, he's a specialist too in internal medicine, but one good stuff I remember about him, he has served in one of our prestigious organization, Medical Association of Tanzania. Ladies and gentlemen, to you this morning, I bring Dr. Elisha Osati. Let's put our hands together for Dr.
Habari za asubuhi. Good morning. Thank you very much. Recognize the presence of Balozi Polisubisia, ambaye ni katibu mkuu pia mstaafu, colleagues wote mlioko mundani, nimefurahi kuwepo hapa. I really thank Rama, who is our colleague, for inviting me to be part of this important symposium. So as being introduced, I'm Dr. Elisha Osati. I'm an internal medicine specialist at Muimbili. I also teach at MUAS. But also I put some membership there because my topic is on building capacity and putting the credentials there. I was the chairman of the committee of training of the MCT, and currently still the member of the committee, but also
efforts to do all that construction was for every room added, you need an extra head. Are we anywhere near filling that gap? No. I currently work at the Jakaya Kikwete Cardiac Institute, where I started before these tours. We see so many patients that, now mark my words, Mloganzila big building will not have been big enough to accommodate the patients that come to the Jakaya Kikwete Cardiac Institute. By the way, that is just Dar es Salaam. Ramadan, you say you'll be going to Dodoma, Mwanza, Mbeya, Arusha. Each of these regions now require their own Mloganzila kind of a complex. Unfortunately, the moment you look at that complex, the awesome size sometimes is tempting to forget what needs to go in there. Not in terms of the commodities, human resource. Here comes, here goes. We have so many doctors littering the streets without employment. We have so much shortage that equation boggles the mind. But you know, the government wouldn't have the resources of employing doctors and doctors alone. Must get some funds for doctors, teachers, and security personnel in the country, engineers, lawyers, economists, all those, same cake. What am I saying? I think we need not to be discouraged by the sheer size of the challenge ahead of us. The best we can do is to bring thoughts together and strategize on how to provide quality services even when we are so few. And for the longest period of time, this is not going to be matched with the corresponding income in terms of hours spent with these patients. Now, I have no intentions of running for any political seat next year. So don't be scared. I'm just being realistic. You are my friends. I'm simply making myself at home. Yeah, we need to help each other. Ni lazima wagonjwa wapate the best of care kila tunapofanya kazi bila kuwabagua. Na kazi hii inaanzia emergency medicine. A little bit of history. Before a majority of you even understood the term emergency medicine, we heard the word fire. What was that department at Muhimbili as we drove in? Casualty. Can you imagine casualty department? What was the meaning of casualty? I've had problems even understanding why it was named casualty. Si tunasikia casualty wa war, wa accident, sijui wa shooting. All right. And sadly, it was manned by people who had issues working in other departments. So we would go there, kichwa kinaniuma, Moisela. Mugongo, Moi. Siku zile ilikuwa ni orthopedics. Mtoto, pediatrics. A and B. That was the only responsibility they would do. No stabilization or whatever. But I think some smart people looked at the situation, and after having been exposed abroad and saw how these patients who were coming to hospital were being handled, they suggested to the government the need to initiate a department that will address patients that were coming to the hospital. So that was Professor Mwafongo, and then Professor Lema came to the office. But the government did not have money. And so this story cannot be complete without talking on the role that Abbott Fund played in this country. And much of the good things that we see shining at Muhimbili were built on that foundation. So Abbott Fund provided the support that enabled the beautiful picture that you presented with the first cohort of emergency medicine physicians to train here, and some of them were taken abroad to go and see real life how things happen. Now, you know, it's public knowledge that Mpoki loves traveling. I don't know who doesn't, but anyway, that's for tea break. Do not limit yourself to this country. When opportunities present, travel. Au baraka nimekosea? Enda kaone kitu inaendaje huko duniani bwana. Because you may think you've seen it all at Muhimbili, kumbe ni vile hata hujaanza kuangalia. Ramadhan alikanyaga tu hapa bondeni, South Africa. He came back a different man. He almost changed his name. I hope you're getting what I'm saying. We need to benchmark against the very best katika dunia hii. And with time, do not ignore the presence of people like Dr. Fire. They will give you more wisdom because of the advantage of living a little longer than the rest of us, but also being exposed from where we started to where we are. And they will guide you appropriately where you're supposed to go. It is important that each one of you desire in your own heart to set aside funds to travel. You will wait your whole lifetime if the government is be the only sponsor for your traveling. Yani wewe si ni daktari, si ndio wandugu? Hii darasa ya leo iko au ni vile mfungo? Sijika kwa ni mfungo imefinyilia watu hapa bana. You all are doctors, si ndio? You need to think beyond the environment where you are working. So for those of you who are in Dar es Salaam may not be making a lot of money, hata enda hapa Nairobi tu basi. Angalia tu vile Wakenya wanafanya hivyo kitu zao. If Nairobi is too common, watu wataona umefika duniani, enda South basi. Because we have contacts. Lakini ni vizuri mwende Uarabuni, muangalie watu walivyo invest kwa health, mwende India. Sisi tunapeleka wagonjwa wengi sana India. Nendeni mkaangalie what is so special with India that everybody wants to go to India. Just go there and learn. Look at how they're doing things. Now India is very nice because while their medical industry is world class, their socio-economic setting, you know what I mean? Yeah. It's a very, very nice place to learn. But I mean, if you have a visa for the US, alikukataza nani kwenda huko? Si ukanyage tu ile nchi ya Biden. Angalia vile watu wanafanya. I'm very sure you will come back with a better refined mind than if you had stayed here. I'm warning you, a majority of the people that oppose the efforts that we put here to improve the health delivery system are people, Elisha, who have not gone out of this country. Au fire nimekosea. These are people who don't know, and so they pride in their ignorance. Baraka ni uongo hiyo. Number two, we need to read ourselves. Each one of us here must be a permanent, perpetual student. Technology is changing so much. Yes, listen to what your friends are saying, but please read on your own. Take notes. And thank God these days our gadgets provide us with access anytime, all the time. All you need is fund your bundle. Maybe you don't have money to register with ChatGPT 4, but even 3.5 can open your mind. Duogal is another one that answers all the medical questions. Go there, ask questions. All right? There's also Gemini, I'm told. So the sky is the limit. Read something. Now, this is going to be very, very dangerous. Do not always strive to remain in this country for work. Mmesikia kitu nimesema? Nimesemaje? Yes. USLME, you pass, you are qualified to be employed in the US. Sasa ndugu, huko US wanalipa dola. Dola moja ni shilingi ngapi ya kitanzania? Almost 3,000. Sasa ukienda mahali Sankara, hiyo mali yenyewe ndugu yangu, huku Tanzania tunahesabu kwa 3,000. Wewe ndio change yako. Okay? And then be a bridge to others. Yazana sasa unajua nilichotoka Ministry of Health nimeshaenda Canada naanza ku okay? Countries such as Canada, they have so many opportunities for employment. The only problem is that people do not want to go through the hassle of qualifying for employment in this country. You need the skill set that you have. You need to pass the exams. Try. The only trouble we've left Nigerians, Kenyans, Senegalese, Ghanaians to be the only people to overpopulate those places. I was surprised in Canada, the northern territories, where you have Yukon, Northern Territory, and the Inuits, there are people from Nigeria serving there. The coldest places on earth, they stay there. There are people from Zimbabwe. Because some of you are already thinking, but Nigeria is very far. Zimbabwe. But there are Kenyans as well. So I need to encourage you to look beyond the borders of this country. We need to export the manpower, the human resource for health. You know, for those of you that are already qualified, it's very easy for you to settle in those places. When you leave, you'll create space for those that are unemployed in this country. Ubuntu spirit, kile uko nacho, unampeana na mwenzio. It's necessary that we create such connections. But, the health commodities at our disposal must be guarded with jealousy. Vitendea kazi. Sisi tuvilinde kwa nguvu zetu zote. Because you might be the next patient to require the use of such equipment. Be it a defibrillator, a monitor, a laryngoscope, a chest tube, those kind of things. There's one area that I also think we need to think critically in investing upon, the nursing skill set. Elisha, you don't sit in the nurse midwifery council, but it baffles my understanding and thought that we are investing in a master's program that offers critical care and trauma while we do not have an undergraduate degree in that field. I thought it was a diploma, then we go to an undergraduate degree, and then a postgraduate degree. But we've started the other way around. We've started with a postgraduate degree. When I was in the ministry, I tried to have them come up with a bachelor's degree. That's not the material for now, but okay. And then, without the nursing staff with the skill set in caring for the critically ill, we shall have wasted our time. The reason for this is because nurses care for the patients when doctors are not there. So we need to invest in them deliberately. You people here are the champions. You need to champion that cause as well. Yes, we work with several. Dixon, you know, we work with so many nurses in the ICU, but are they as skilled as Keisha? Yeah, truth be said, Sankara, you know what I'm talking about? Yeah. Baraka, we have a nurse. You need to be careful before you start saying that's not right. How did she get that knowledge? She simply learned. So we need to encourage the nursing cadre. But the other area that we also need to invest heavily upon are the physiotherapies to support critically ill patients. Each institution. I don't know if we shall standardize the equipment in the country. I don't know. But you have to remember that the further away you move from what is common, the more complicated it will be to service such equipment. I'm not trying to promote any product. Nataka tu niwachie mufikirie. If we go to the automobile industry, this country is loaded with many Toyotas. As a result, you can service a Toyota anywhere in this country. Sasa wewe chukua BMW yako tuipeleke Unyakyusani, ikafeli huko. Si utapeleka gari ya kubeba hiyo gari? Yet a Toyota, even a big Toyota like the one I'm driving, chini ya mwembe mtu anakuambia no bosi, huko engine inatugusi lakini hii hapa ndio inatoa upepo. Tutafunga alafu kifika mjini watakutengenezea gari inaenda. The same thinking must be employed when we decide on which equipment to bring to the hospital. Ask your neighbors in the region. Kama Dar es Salaam, nyie mko na ventilator gani? Oh, sisi tuko na Savo Maki. Okay. Huduma yao wanajitahidi, kila wiki wanakuja kuangalia. Dickson, nyie mko na gani? Hiyo hata jina yake hatuijui bwana. Sisi tuna kitu inaitwa Hamilton. Si ngapi? Sijui C2. Iko mzuri. Mwingine Drega. Hapo ni mkoa mmoja tunazungumza. Mwingine anasema hii tuko na ventilator hata jina yake hatujaijua. Iko hapo. Sasa ikiharibika sasa. So remember, they have a half-life, and that half-life determines the service you're going to draw from them. If we are going to buy machines that are not adequately serviced and supported, the care that we need from them is not going to be optimally obtained. This conversation cannot end at this point. But all I've simply said here is that human resource for health building or development is the only solution to bridging the gap of critical care and emergency services in this country. How do we do this? Each one of us must be deliberate, must be intentional. Institutions must be ready and willing to sacrifice, to have people that are going to offer treatment like Muhimbili discovered and the ministry testified that wagonjwa walikuwa nakufa sana Muhimbili, lakini toka tulipoweka emergency medicine vile vifo tuvioni kwa wingi. Simpige hata makofi kidogo kwa hiyo. That is what you and I are supposed to invest in. That's what each one of us is supposed to live desiring to achieve. So this symposium is simply to empower us to help deliver quality services in those facilities that have cost a lot of money to build. Don't forget, our existence in this world is finite. So as you are being developed, remember to develop others to come after you. Because I'm trying to imagine if Dr. and my Professor Ipuge here had not encouraged us to do serious microbiology, a resistance pattern in the ICU would not have come. And now I'm looking back and I'm looking at my students, and those are going to look at others. Let us hold each other and move forward. And for sure, this symposium on emergency medicine and critical care will be a force for change, not only now, but consistently in this country. God bless you as you deliberate and meet this year. Thank you very much.
Let's continue putting our hands together for Dr. Oki. Thank you very much, Doctor. Those are wonderful notes to take home. And personally, the last part, where you said, don't forget to pass the skills and knowledge. I'm sure you don't remember me. I'm sure you don't remember me, but it's okay. You taught me 10 years ago in one of the medical schools you used to teach. Fellow colleagues, I'm a doctor too. Don't worry, emceeing is just part of the God-given gifts, but I still practice. I've seen a lot of colleagues that I've worked with from different hospitals. Thank you for joining us and joining EMSA. I'd like to welcome Dr. Yaya Ipuge for a vote of thanks to our esteemed guest of honor. Please, let's put our hands together to Dr. Yaya.
I used to be an MC as well, but I don't take people by surprise. Thank you very much for this opportunity, and for EMSA and others for organizing this, because having a symposium like this for people where they are given the knowledge, at least some of them without paying, is very important, and you are doing a good job. Dr. Mpoki, and we want to thank you for that illuminating speech you gave. I was sitting there remembering the days where you were sitting on the other side, trying to make you all calm and listen. But I was sitting there calmly, so you really captivated me, and I'm sure the rest. And you have spoken a lot of important things that for us and for the audience here will be kind of the way forward. I think the standardization is very important, and in particular because even when you are training people, when they are using, for example, you are in a place, your equipment is broken down, but the neighboring facility is similar, then you can just borrow and work together. But also you have touched, I remember my professor, Dr. Donald McClat, if you remember him. We were sitting, we were in the ward, Mwaisela, and we had a patient, diabetic coma. He was drowning in his vomit. He was groaning there. He said, you see this patient is drowning here, but he's make sure that this hospital bed is safe for a known male. You know why? Because here we know you, but it might happen to you some other place. You have fallen on the road and you are taken to an hospital as an unknown male. That's where you'll see the importance of a safe hospital bed. So it's the same as the example you gave, but in a similar way. So it's our job here to make sure we train ourselves, we encourage others to train, so that, so imagine you are a critical care specialist. Then you have a problem and you go to a hospital, there's no critical care specialist. You die while you could have saved yourself if you were the carer. So we must make sure that this knowledge is spreading out. So I think we thank you also, everyone who made this possible in any way, either by giving us a beautiful venue or by explaining the beautiful equipment that are there. The people from Cuba who have been here since long time. I mean, Cuba has been, when I was a young doctor and whatever, the Cuban contingent of doctors were always helping many hospitals, especially at Muimbili, we had them a long time, but also some of our young people among who went for training there. The conditions and types of diseases in Cuba are similar like here. When they come here, they are really practical. So I have very good memories of Cuba. I've not trained there, but I know for our age, Cuba was the good example for many things. And I think Muimbili, I think when we talk of emergency medicine, we remember Dr. Dominic. Now we have such people who now, that was the casualty. It started changing. So I'm glad you are all here. So we would like to thank every one of us who came here, but the chairman of EMSA and your team, I think you are doing a good job. God bless you all, because thank you very much.
Thank you very much, Dr. Yai, fellow MC. And let me tell you, colleagues, this means that I will live this long, that long. They did not get it. So he is a doctor, and also he served as an MC, and I'm this young. This means I'll live that long. Living that long means we want to see SEMC in the following years growing. From the guest of honor's speech, he spoke of big academies, institutions, machines. This means all our industrial partners with us here, public and private hospitals, we acknowledge the efforts, and also we still welcome you to take part in this wonderful program. Ladies and gentlemen, our SEMC program for these 3 days is packed with 6 trainings: BLS, Basic Life Support; ACLS, Advanced Cardiac Life Support; International Trauma Life Support; Basic Training, ABG, Airway, and ECG. Make sure you are in a proper location at the proper timing to save time and to get all the preparations done by your instructors and facilitators. I hope that comes in very clear. At this juncture, I'd like to welcome the high table for a photo session at the lobby area, led by Dr. Fire and Dr. Rama, please. Let's put our hands together once again to our esteemed guest of honor, Dr. Mpoki Ulusbisia, and your team. Thank you very much, and we appreciate. The rest of the colleagues, please be seated for further directives.